would like to welcome the athletics coach for the SC Fortuna Cologne. Currently, he's writing his PhD at the Sports University Cologne, focusing on the effects of a dynamic EMS, whole-body EMS training on professional soccer players. And I'm happy to have him again as a speaker, Filipovic. Well, hello, I hope you can hear me well. Thanks very much for the introduction. I'm here for the third time, so 3 consecutive years for EMS. I will be talking about the integration of whole-body EMS training into competitive sports, using soccer players as an example, because this is my discipline. I will actually walk you through the studies, compare results, and actually develop this into recommendations. And to conclude, I will report from my practice as an athletics coach for SC Fortuna Cologne. Not everyone has a football background. When you look at the football over the 10 past year, then you can see that football has become more dynamic. The sprinting distances have increased, more sprints per match, and the sprints are turning into the performance limiting factor. You can see that 45% of the goals are scored after a sprint. So half a step can decide whether I score that goal or not. So sprinting abilities are key. When developing the sprinting ability, maximum strength is decisive. Studies have clearly shown the higher the maximum force, the higher I can jump and the faster I am on the first few meters. This is the theory. It sounds nice, but the implementation in everyday training practice is anything but easy. Football, soccer, has a specific, and this is that I have a competition every weekend, unlike in other sports where I have a competition every few weeks or months. In addition to this, I have 6 straight training units, and the competition is so intense that I, as a coach, I'm forced to actually schedule 2 to 3 days as a regeneration phase to give my soccer players enough time to regenerate, so that I can really rely on this player 100%. On the right-hand side, I can see the training intensity just as a rough guideline. But you can see that the competition on Saturday in terms of the stress is higher. The stress is higher than on Tuesday. So when every 3 to 5 days, I would like to include EMS for enhancing performance, I cannot do it before Tuesday, and the second session would have to be Friday or Saturday, because Saturday I have the next match. So I always collide with the match. And my biggest premise is to have a fit player on Saturday. And this is why controlling performance during the season is so complex. Looking at athletics training in professional football, you will see that we don't want to enhance performance, but that we want to prevent injuries first and foremost. Why whole body EMS? Well, the studios were able to prove that the same increase in strength, maximum strength, could be achieved in as little as 8 weeks. Comparing strength training with whole body EMS, I can see that the stress on the joints is so much lower. So no long introduction periods must be introduced, or like in Olympic weightlifting, I don't have to train the trunk stability or stability at all to be able to work effectively. Whoever has applied these methods, don't get me wrong. I love classical strength training because it produces an effect, but I know that I have to allow for a certain time until an athlete really efficiently benefits from it. This is the big benefit of EMS, whole body EMS. Add to this that I can actually control more muscle groups. I can work with specific movements, and this means that specific movements can be catered to, and I can actually support the performance transfer, strength transfer. Add to this that I have a maximum of 20 minutes as a training period, so I can easily integrate it twice a week. I don't have to enhance or prolong my training times. And what is also key, why I looked at EMS training, EMS is a complete stimulus for muscles. It allows me to complement the stress structure in football so that I can actually increase the performance of players who have been on the pitch for a long, long time. Don't be shocked. Just briefly, we try to actually approach this systematically, scientifically, and this is why we worked through our way the complete EMS literature. We subgrouped it, local EMS studies, the whole body EMS studies, and we actually centered on sprint time, jump height, isometric and dynamic. And we also made a distinction between untrained, trained subjects and athletes. In the analysis, we of course focused on the results with trained subjects and athletes, competitive sports people, because after all, we wanted to define training parameters and to come up with training normatives in order to implement and integrate it effectively into competitive sports. The stimulation program was then put into practice in 2012. We actually tested it for the first time with the team, the Cologne team. We had one EMS group, one jumping, groups 2 were excluded. The EMS group did twice 10 squats, and the other group the same jumps without EMS. In order to actually calculate the effect of the jumps. Twice a week plus 6 to 8 training sessions plus the match on the weekends over 14 weeks. The results were really interesting. In 2016, we did the same thing, but this time we actually integrated competitive soccer players who only had 3 to 4 training units per week, but the trained subjects group was widened. So in addition to the EMS jumping group, we had a control group that we built into the study in order to exclude the effects of the training sessions, the football training sessions. All of this in addition to the 3 to 4 training units, plus the match over the weekend. The study lasted for 14 weeks, and as the second half started, after 7 weeks, we got the schedule going. In the individual tests, we actually measured right before the EMS training, and we extracted blood right after the EMS training. In the second study, we shortened the interval because we saw the influence factors are pretty big when I actually build in the soccer matches for 14 weeks. So we shortened the period to 7 weeks. We had the pre-test, the post-test, and the retest after 3 weeks after a training break. Identical to the first study, we had the training, the blood extraction pre, post, and 24 hours post. The parameters, this was the first study where we integrated it or tried to integrate it into competitive sports training. We have strength diagnostics, jumping diagnostics, and the scoring speed was looked at. And we did blood analyses, some stress parameters, and we used IGF-1 for muscular adaptation as a factor. And we came up with very interesting results. And this is why in the second study we went a little more broad-based. We looked at many, many parameters, and this is only part of them. And I won't actually explain all of them. We integrated parameters in order to reproduce the results or make them comparable, like the jumping and the sprinting diagnostics, then also integrated endurance diagnostics, then muscle biopsy and signal proteins were looked at, and muscular adaptation on the cell level, and various stress markers in the blood were also tested. As I said, I will not walk you through all of them because this would go beyond my presentation. I will focus on the ones that are comparable to actually be able to draw conclusions for our practical training recommendations. Let's talk about the effect on maximum strength. This is really the central issue for competitive sports because maximum strength is related to sprinting speed and jumping strength, etc. In the first study, what you see very well, after 7 weeks, after 14 weeks, you can see an increase of 16% in maximum strength after 7 weeks. After 14 weeks, it was even over 20% on average increase. In the jumping group, by comparison, there was hardly any change we could prove. This is an interesting point because whoever has undergone training and trains on the verge of the performance limit knows that 16% increase is quite a magnitude. We took an even closer look at it before and after 3 weeks, after a 3-week break in the training. And we were able to reproduce results almost one-on-one. We had a 16% increase after 7 weeks in the strength. We widened strength diagnostic and included leg curl. So we were also able to increase by a certain percentage the strength of the leg curler, which is an interesting parameter. Regardless of what you do, the extensor and the curl of a leg, this is still the muscle group that is most susceptible to injury. And if I can actually strengthen my muscles there, then this, of course, also helps to prevent injuries. There's a clear correlation between jumping and sprinting. So it did not come as a surprise that in jumping strength we also posted increases. The data showed that the maximum strength increase could directly be transferred into movement. What's striking is that only after 14 weeks we could see significant changes versus the initial test of roughly 10% in squat jump and in counter movement jump. The jumping curve shows a slight change, but not a significant increase after 7 weeks. Also striking, we wanted to know why this is so, the delayed adaptation of the speed and acceleration parameters. EMS is often being criticized because repetition samples cannot be included, and this is why there is no transfer of strength guaranteed. Either there is no direct transfer possible, or the direct transfer into movement takes longer time. In addition, in week 4 to 6, we had more matches. There were English weeks, so the jumping parameter is a sensitive parameter that reacts to muscle stress, and this, the many matches may have caused an exertion, an overexertion of the muscle system of our players, and this is why they could not actually perform top. This is also overlapping with the current 2016 study. Unlike here, after 7 weeks, we could already see an increase in the maximum strength in the squat jump and in the counter movement jump, and we were able to prove it. This means through the jumps, the squat jumps alone, we were able to integrate the samples and support the strength transfer. Here you can see the control group, no change, so we can exclude the effect of the jumps. And the training has an influence. So the improvement is clearly attributable to EMS training. This means the delayed adaptation in the jumping strength must be attributed to a higher stress on the muscles. So the delay is due to this. When you look at the CK values in the serum, creatine kinase in the serum is an indicator that points to muscles under stress. The higher the value, the higher the stress on the muscles, the higher the muscular damage. Be careful with this word. The higher the value in the serum. The CK values for an untrained subject is between 100 and 200 for athletes. We're speaking about 300 and 500 CK. Everything beyond 500 would point to higher exertion. What you see here is an acute increase in CK values 24 hours after the training of 500 to over 1,000 CK. So something must have happened there in the muscles. So there must have been a very strong stimulus acting upon the muscles. What was surprising was that the value did not drop off immediately, and there was a muscular adaptation. No, the value was constant over 7 weeks, even acutely increased to over 2,000 CK. Here, the jumping group, by comparison, the value remained constant. This was the values we measured beforehand, around 500. Only after 14 weeks, there is a muscular adaptation to the EMS stimulus. Every week, initially, we actually adapted intensity, increased intensity this is, but you certainly have a cap. You cannot increase it every second week. Here, 40% for all muscle groups, and this is clearly less. We only increase it by 15 to 20% for each muscle group. Which also needs to be said, we had more matches between weeks 4 and 6. So this probably also kept the CK values high. But look at the values from the current study. This is before and 24 hours afterwards and right after the training. The results were reproducible, 1-to-1, one-on-one. So again, in the initial test, a clear increase to over 1,500 maintained until the final test, the outgoing test, which closed with the values as high as 2,000. Here, the jumping group, no reaction, and the control group also remained constant. So not the matches, the additional matches keep the CK values high. Only the 2 EMS units per week plus a match during the weekend. So every 2-3 days I have a stimulus for my muscles, and this actually produces an increase in the CK values. So muscles cannot adapt if I continuously increase the intensity. The question, can EMS trigger muscular adaptation? We built IGF-1 into the first study. This is an indicator of muscular adaptation, muscle building. This is the mTOR cascade path, and it is activated through the cells. This is an indicator for muscular buildup, hypertrophy, for instance. But neither in the EMS group nor in the jumping group we could detect chronic effects or reactions to IGF-1. Then there was no change in body weight and girth. The data shows, or said initially, that not a lot of muscle buildup took place. This was just a first attempt to draw conclusions. IGF-1 one is not enough. It must not necessarily be actively involved. This is just one of many possible signal cascades that can cause hypertrophy. And this is why in the second study, we rearranged and did muscle biopsy in order to look at the cell level. Here you can see the muscle fiber cross-section, the control group, the jumping group, and the EMS group before and after 8 weeks. In the type 1 phase, there was no change, but striking in the EMS group, there was a clear trend around 12% of the growth of the cross-section. 0.05, this is statistically not significant, but there's a clear indicator that there is something happening in the muscles. This means you cannot say that hypertrophy took place, but there's a clear trend. And thinking that I only built in a net time of 2 minutes of contraction time, then this is a striking effect. Then we looked at endurance strength, the VO2 peak test and the VO2 resting until full exertion, and we couldn't see any effects. There were no effects. There was no impact on VO2 peak nor on VO2 rest, neither in the EMS group, the control group, nor in the jumping group. The only change took place in the VO2 resting phase with the EMS group. This result is congruent with what we saw about the cross-section of muscle fibers. Type 2 fibers, when I increase the mass of type 2 fibers, they require more oxygen. So at the end of the day, my oxygen demand in the resting period also increases. This means that something happened to the type 2 muscle fibers. In summary, what are the insights? What are the take-home lessons? We saw that 2 EMS units, in addition to the team training, are sufficient to achieve the maximum jumping, sprinting, and strength abilities significantly only after 7 weeks. And the results are congruent with what local EMS training studies produced. The gains are moderate. Local by Martinez, Maffionetti, they showed increases by 20 to 30%, but this is for local EMS training. We've integrated jumping, and we did not actually edit it to EMS. We just actually did it in as an alternative to the EMS training. We were able to prove that 2 EMS units per week, in addition to the team training, are not sufficient to increase the maximum strength. And in terms of the stress on the muscles, we were able to prove that this is an extreme stimulus, and based on the current parameters and oxidative stress, we could also say that this is a high metabolic stress for the muscles. At the end of the day, on CK values, they're not sufficient to draw conclusions about muscular stress. We proved values as high as 2,000. When we look at the values produced by Professor Kemmler this morning, who showed values over 20,000 on average, then these are values that we have never achieved, and our values are really moderate by comparison. We also documented all of the dropouts over the 14 weeks, and in the 7 weeks for the second study, there were no dropouts because of injuries or anything else. So the CK values around 1,000 to 2,000 are the norm, are a standard for professional soccer players or competitive athletes. So they don't have to be taken out of training. In view of the muscle adaptation, we've seen that there is something happening caused by EMS training. Although it is not significant statistically, we were able to prove that through the EMS stimulus muscle adaptation is caused. Maybe more than 14 or 7 weeks respectively are necessary to cause hypertrophy. And the local EMS studies showed the same thing. They drew the conclusion that strength increase actually goes back to neuronal nets, whereas muscle adaptation only gets going in later phases. Well, so what are the lessons learned for my practice now? And I will report from my experience now. Dynamic exercises are preferable when you combine EMS with jumps, for instance. And we always focused on clean jumps and nicely exercised with a low intensity. EMS is effective in the submaximal area. This is what we know. And as long as the player can move properly, the intensity is low enough. We were also able to show that the integration of jumps actually can produce a positive side effect. And to support the performance transfer or strength transfer, it is advisable to integrate additional jumping training or to integrate further strength training. The execution with additional weight, there is a lot of EMS being done with additional weights, but studies showed that this is not even necessary. When you focus on acceleration, you focus on explosive exercises, and it doesn't require additional weight. My colleague Lutz proved with long dumbbells in a study that the higher the additional weight, the lower the actual impact of EMS training. There's an overlap. In order to work with the right intensities, I need 1 to 2 weeks as introductory stage, allowing my soccer players to get accustomed. Football players take a little more time, and 1 unit per week is enough as a trial. And then I can actually get started with the right intensity of stimulus. We also stimulated the thigh and the calf muscles in our studies. Whenever we produced effects, the system is not ideal for stimulating calf muscles. They often reacted very sensibly, and this is why I recommend to actually go for a classical plyometric training when you want to train and strengthen your muscles in the calves. To conclude, from my work, the way we do it and integrate it in our Fortuna Köln training, for rehabilitation measures, we want to retain explosivity and maximum strength, and we want to bridge training breaks when players are forced due to knee joint pain, which often happens when you change over from soft to hard flooring, need to be bridged. So we actually use EMS as a replacement training, so to speak. Then this is a patient after a knee operation, sitting, so to speak, and as soon as they can stand again, they can actually train again. The main focus in our work is on a targeted increase in strength. It is about acceleration and jumping ability, and this in addition to standard strength training. This is not a replacement for strength training. It is an alternative. It is a combination. And we only use it for players where we feel that we can actually create a new stimulus. When a player aged 18 or 19 sees me the first time and is not really familiar with strength training, I would not actually apply EMS training. I would actually recommend strength training. But when when they've gone through some time with strength training, then I would use EMS training as an additional stimulus. Jumping force and acceleration, explosivity. The training period is 8 to 12 weeks. We actually include 1 to 2 weeks as an introductory phase. We stabilize the torso and the trunk in addition to the thigh. So we focus on the extensor and the curl. And we do classical squat jumps, even single-legged jumps, skippings, various versions, 3 to 4 series with 10 max repetitions. Every week we adapt initially, whereas later we only increase the intensity once per week to not add another stimulus because you have a match 2 days later. And all of this in combination with the specific strength training, so combined with squats or Olympic weightlifting and specific jumping and sprint training on the pitch. Here, one example of our training plan. This is the Saturday match. It's 6 to 8 training units, plus the athletic focus in small groups on Tuesday morning. And then there are additional individual units, 1 to 4 units after the team units or before the team units. When we integrate EMS once a week, then it would be done on Tuesday. If I play on Saturday, then I need Sunday and Monday as a regeneration phase so that my neuronal systems are regenerated. So the first unit would take place on Tuesday, 10 to 12 minutes, and would then combine it with squats, without any additional weights. It's only about building in the same patterns. And the second unit on Thursday before the training, we would train the explosive strength, weightlifting, and would then actually transfer this to the pitch with acceleration, explosive speed, etc. And if we build it in twice a week, then it would again be Tuesday in combination with a classical strength training, and on Thursday it would be before the group training, or on Friday before the team training, and again in combination with jumps and squats. That was it for me. If you have any questions, I'll stay around.